Let's be honest, modern medicine is broken. Patients are dismissed, doctors are exhausted, and mental health care is decades behind. So it's time to disrupt the status quo, to challenge a system that fragments care, dehumanizes patients, and burns out clinicians. I'm Dr. Georgine Nanos, and this is The Kind Revolution, a podcast about breaking old paradigms, rebuilding medicine with compassion and science, and reimagining what healthcare can be when we finally get it right. Because change is here, and it's starting with us. Welcome to the revolution. I'm Dr. Georgine Nanos, and today I have a very special guest, my friend and colleague, Dr. Patricia Wallace, also known as Dr. Trish MD. Dr. Wallace is double boarded in gynecology and female pelvic medicine and reconstructive surgery. She is the owner and director of the Center for Pelvic Health and Wellness in Orange County. She's a national speaker for BTL, a wellness sponsor for OC Fashion Week, and has a passion for restoring women's pelvic health, sexual health, and quality of life. Beyond her medical expertise, she's also a yoga teacher, life and wellness coach, autism warrior mom, and lover of roller skating and dancing. Well, hi Trish, welcome. I'm so excited to have
That's
you here.
right.
I always
Hi.
love chatting with you. Like we always have the most fun conversations, and I think we need to share them with the world because you have so much to say. So let's just talk about your journey and
I
what
know.
inspired you to focus your career on pelvic and sexual health and how that's all been for you.
So I came to medicine in a very roundabout way. I've been a fitness instructor to some degree since I was 20 years old. And so when I got to college, I started studying physical anthropology because I also have this love for travel. And I thought, let me study the body. And it was just this really weird background. And it brought me to anatomy, which really clicked with my love for the body and just the miracle that we are. And I ended up going pre-med, getting my degree in physical and pre-med and fitness. So I have this sort of hodgepodge of a background, thinking I would go into sports medicine or something. Turns out that when I got to medical school and I did my OBGYN rotation, which I thought, I am never going to do that. I don't want to be up all night. There is no way that I'm delivering babies. And it was like this crazy, fast-paced, adrenaline rush type of experience. But then I was also taking care of women of all these different ages and stages. And so I ended up doing OBGYN, but soon realized that I liked the surgical aspect and also taking care of women in menopause, restoring quality of life. So it came to me that way. I did 4 years of OBGYN and then quickly went to UCI as an assistant professor and decided I wanted to specialize in pelvic medicine and reconstructive surgery, which is what I do now along with menopause and sexual health, because
Awesome.
It's all this amazing little bundle.
You talk so much more about women's health than just vaginal health. You talk so much about pelvic floor and muscle health for sexual wellness and incontinence prevention. Tell us a little bit why muscles matter so much for pelvic and sexual health, and what are some common signs that a woman might need pelvic floor support or therapy?
Sure. But it's so interesting because I didn't really put it all together till I was further along in my practice. Having had this background of fitness and lifting weights my whole life, I knew that having muscle on my body gave me more energy and more stamina and made me feel and look more youthful than most people around me of my same age. As I started taking care of women and seeing their health decline, typically like 60s or 70s, really, in my practice, I thought, one of the big things with these women is that they have very little muscle mass. They're of a generation where they weren't avid exercisers, especially not of any sort of resistance training. And along with that was the change in menopause, where we have low hormones, which also diminishes our ability to build muscle. We gain belly fat all over our bodies. We lose strength. And then the pelvic floor starts to suffer about that time as well. So it's not that we don't have incontinence or pain with intimacy before this cutoff of 51, 52, which is when hormones drop. We start to see then over the next 10 years, drop in muscle mass, increase in body fat, lower stamina, all the things that happen. But it's very coincidental as well as associated with the change in our lives. And as I see women live longer, They have poor pelvic health. That translates to poor bladder and bowel control, which nobody talks about. Pain with intimacy, whether they're in a relationship or just even the ability to achieve orgasm. Increase in bladder infections, which I see increase significantly when we come into our menopausal years if we're not supporting the skin and tissue down there. Urgency, frequency, waking up at night, and then even just getting up out of a chair, getting off the toilet. When we start to lose that core strength, women have increased risk of falls. And we know, and you know more than even I do, taking care of that population, if they fall, their risk of really having a long-term.
What are some things that we can do as women to help restore that pelvic health and bring us back into balance from more of a pelvic floor standpoint that you love to recommend that have worked for you and your patients?
Sure. I think the first thing is letting every woman and man know for a fact that
Exactly.
Pelvic floor, because most of us don't think about our pelvic floor unless something goes wrong with it. And the pelvic floor is literally just a bowl of muscles that holds up your trunk, and being aware of that's an integral part of your ability to walk and lift and stand and balance. And women of all ages are doing lots of sports, but if they had even an awareness of the pelvic floor as part of their core and just a little bit of education. Of course, there's a million different things on YouTube. There are pelvic floor physical therapists that are great about teaching technique and breath of just awareness. It doesn't even have to be like go home and do 1,000 Kegels, because none of us can really do that anyways. But I think awareness and education of what that is and what it supports is the first step at a younger age, even before the first pregnancy. And then also knowing that any sort of trauma to that area, whether it be a pregnancy, a childbirth, obesity, and the heavy weight that it puts on our pelvic floor, heavy lifting, chronic cough from asthma, or even having a bad bout of bronchitis or COVID. I can't tell you how many women come in and say, I was fine till I got X, Y, or Z, and now I pee my pants every day. Just being identified that there are risk factors that we can modify, having a proper weight, making sure that you are your own advocate when you are seeking to become pregnant and say, you know what, I want to build strength before I carry a pregnancy, because childbirth vaginally is the biggest risk factor, but pregnancy also is a risk factor later on in life. When we all hit 51, 52, everything is leveled out, and women who have had even C-sections have a risk of poor bladder control. And then ultimately, the other things that we can do is just learning how to do proper resistance training and weightlifting. And it's interesting because, of course, it's the big buzzword, everybody, women lift heavy. But my next endeavor is to put out some videos to say, yes, you can lift weights and not destroy your pelvic floor, because you shouldn't be doing these big, heavy hack squats and heavy weight squats when you can actually be doing lunges and machines that will actually protect your pelvic floor, because most of us don't know how to hold our pelvic floor properly when we do those heavy exercises. So that's the biggest thing I see right now all over the weightlifting influencers for women, is that lift heavy, lift heavy. And I'm like, you're not talking about any protection for these women pelvic floor. And they've got these 80-year-olds carrying these crazy heavy weights. And I know it's progressive as far as what they're teaching to lift, but in the end, there's probably better ways to build muscles.
Yeah, I totally agree.
That don't
TikTok,
include those
and I'm
things.
like, ooh, not to mention all the other potential injuries that can come from that. What about some of these energy-based devices that both you and I work with that are really novel in this space in the last 10 years that have made it much easier for women and men to strengthen their core and their pelvic floor? Tell me about those.
Absolutely. Probably more than 10 years ago is when we actually got our first radio frequency device for the practice. And at the time, there were 2 devices out there to rejuvenate, restore, renew, however you want to put it, the vaginal tissue. And that was really a time when women who had breast cancer were really not allowed to use any estrogen. There was just a lot of this misinformation out there. They weren't able to use cream locally to their tissue. Their oncologists were really very hesitant to allow them to use that. So we were looking for an alternative to help restore pelvic and intimate health in our patient population. And so we actually ended up getting our first radio frequency device many years ago, which, as radio frequency is a way to gently heat the skin. Any part of your body radio frequency can be applied to, and it actually restores, rejuvenates the underlying collagen, blood flow, and actually neural tissue. And so we started that many years ago in the practice. And that's just one layer. So I always talk to my patients about we need to restore tissue health and then muscle health, because those are two layers of pelvic and sexual health. So we have radio frequency, and then we come 2018, 2019, we have magnetic energy that can actually deliver a full maximal contraction to the pelvic floor, which up until then, we really didn't have anything but good old fashioned Kegels, which most women can't do. At least 7, 8 out of 10 women do not do a proper contraction, even after they've gone to pelvic floor training, which is essential for learning breath and technique. But when it comes to bodybuilding, even functional electrical stimulation, which is basically a probe that women have to put up their vagina and stimulate their muscles, who wants to do that? When you can sit on a chair fully clothed and catch up on your emails and actually physically make the muscles bigger, stronger, and more elevated. So I'm a huge advocate for the Emsella chair. That's the high frequency electromagnetic device that we have. When I talk to my patients, it is always part of their treatment plan, even if they're going to have surgery for something. I'm like, your muscles count so much for not just this issue, but if you're looking long-term health, longevity, not to fall,
I love
getting
that.
off
And
the toilet,
beyond
like,
the
you need to
Emsella, the
build this
Emsculpt
base.
Neo too, like you were saying, a lot of people don't realize that core, and Neo Emsculpt helps with the core as well, but that core and the pelvic muscles, they're all connected. And I think using them in combination, I know you do that a lot, and we all do. It's just amazing and can just do so much more
Amazing.
than we can do with our own
Yeah.
bodies. Like, it's impossible to do 10,000 Kegels, which is what the Emsella does for us. Now, let's get into the hormones, because this is one of my favorite topics, and there's so much misinformation out there. There has been, there still is, and that's one thing that I think a lot of women have so many questions about right now. There's so many myths around women's health, like hormones causing cancer or having to stop after a certain amount of time. Can you start to debunk some of these for us? Because I know that's what everyone wants to know these days.
I know, it's so true. And I have to say thank you to
Totally.
Halle Berry and Oprah for going through menopause, because at least it brought a national spotlight to the fact that women have been suffering for the last 20 years with misinformation, and the fact that their providers, their OBGYN and their primary care providers, have told them that you cannot take this. It happens to me still every day when I sit down and do a hormone menopause longevity consult. It's 45 minutes because I'm going through slides and we're talking about things. And everybody is, my doctor said I'm going to get cancer or I'm going to have a stroke and I can't take testosterone. And by the way, I have to go off of this in 5 years. And it is so difficult because I have doctors younger than me who are practicing primary care, right? Who are telling their patients, you can't do this or this is bad for you. And our poor patients just don't know what to do. I'll say that luckily there's a little bit more people out there, providers who have a little bit more of a national stage in their social media, that have at least begun the conversation, that we know that the Women's Health Initiative, the study that scared every woman off of hormones, at least 80% of women stopped taking hormones 20 years ago after that was published. We know that data actually is flawed and it does not speak to how we take care of menopausal women. We know that estrogen does not cause breast cancer. And in fact, progesterone and testosterone are breast protective. We know that you don't have to go off of hormones after 5 years, because then what are you going to do? You're going to be right back where you started. I do tell women, I want you to look at it like this. We now outlive our endocrine glands. The thyroid often slows down the ovaries, the testes by at least 25 to 30 years.
Right.
Only 200 years ago,
No one cared what happened after that.
We died at 45 or 50. And so we haven't caught up with, the glands just don't produce what they need to for the rest of our life. And so it makes sense to give your body back what you're missing. And that's the way I approach it. If your thyroid's not working, we're going to give you some thyroid support. Your ovaries are not working, let's give your body back what the ovaries make. Testes are not working, let's support that as well. And I think that makes sense to women. The other thing I tell women is that these hormones are in your body in great amounts up until about 51, 52, and they're awesome for you, right? Nobody says hormones are bad. And as soon as you're 52 and you have none and we give them back to you, they say these hormones are bad for you. And that makes zero sense, right? So those are some of my big arguments with that. I will say in that influencer world, you still get a lot of split about how you should take hormones, what you should take. Should you do creams or pills or patches or pellets? And what I tell my patients is that whatever you choose to do, one, be educated about what your options are, and two, make sure your doctor is listening to you, following some labs periodically, and following your symptoms, your side effects.
And I think the other
My
important
bones, my
thing,
heart,
because
and my
there's so
brain.
many people entering this space now that may not have the scientific background, I think it's very important for people to choose very educated, scientifically evidence-based providers, because that's one of the things I'm seeing. Everyone all of a sudden is a menopause expert, and that worries me, as I'm sure it worries you as well.
Yes, I see it on
Right.
Instagram. Get your menopause certificate. And I'm like, who are these people? You could have a coach that's going to talk you through the diet and the exercise. I think
Yeah,
that's amazing.
yeah, exactly.
But make
You
sure
mentioned
someone's following you
testosterone, and
closely.
that is one of the hormones that I think there are a lot of misconceptions around. Let's look at that in a little bit more depth. Why is it so important for women? It's the one hormone that's still not, like, insurance won't cover it for women. Like, what's the deal?
I know it's really unfortunate because the FDA did not approve the one and only drug, which was a testosterone patch that went through a study many years ago looking at the impact of testosterone on women's sexual desire. And because there wasn't a big enough difference in the pre and post treatment group, that it therefore was not approved for production for women. And so we don't have any FDA approved version of testosterone for women. Yet at any one time in our lifetime, our circulating testosterone is higher than our circulating estrogen. And in fact, 100% of our estradiol is produced from our testosterone in the ovary. And if we just switch the units on the lab, you'll actually realize that your testosterone level is higher than your estradiol level at any one time. Now, that being said, there's a range that the lab says is normal. And then in menopause, some of us who give hormones to women will bring women a little bit up into that higher range, because we end up finding that it really does support our sexual wellness, meaning desire, arousal, ability to orgasm. But testosterone is also responsible for drive. So drive meaning I'm motivated to get up and go to the gym. I'm motivated to get my work done today. It is more of a driver. The other thing is it does support muscle mass. And unfortunately, the studies out there are mostly about men and testosterone and muscle mass. But we know that also even testosterone supports proper bone health. And also there's many studies looking at testosterone being breast protective. And you'll find still lots of opinions about testosterone out there, but most of us who give functional hormone support will put women on testosterone because the side effects are quite low if you're not going into these crazy super physiologic levels. And what does that mean? So any lab slip will say like an upper limit of normal would be like 60 for women. To become like a man, you need 500, right? That's like the minimum, probably every day chronically, to get lots of hair and
Right.
lots of changes. Men are ideal at 9 to 1100. So we have this huge range. Like really, women are 10 times less than what men should be. And we can play around with those upper limits of 60, 70, these low 100s, and really have very little side effects. And there's
That
a
is
lot of
something that a lot
opinions
of
even about
women
that
don't
out there.
realize, that it is an important hormone to balance things out. The drive piece, I think, is also really key, because as we approach perimenopause, it is like there's so many factors in our lives that do lower our drive and just make empty nesting, all of that brings a lot of emotions into the picture. And so that certainly helps. Going the other spectrum of the women of the other age span in women's lives where we talk about hormones is birth control. And I've been seeing this a lot, especially in the social media world. There's this misconception that birth control is harmful and should be avoided, and that it's going to give you cancer and all this stuff. Please, let's get this out of the way and clear up the story for people, because it's driving me crazy. Yeah.
When we talk about birth control, you're referring to the birth control pill, I'm assuming. Obviously, when the birth control pill came out, it was revolutionary, right? It really changed women's health, the autonomy to take control of our bodies and to be able to protect ourselves from pregnancy. Early on, the levels of estrogen that were given in those, and these are synthetic
Right.
estrogens, usually ethinyl estradiol, were too high, super high, lots of side effects, increasing risk of blood clots and headaches and nausea and all the things. Now they've got it down to a science. The tiniest dose of estrogen and progestin that can allow us to have proper birth control, so prevention of pregnancy, but also impact our ability to have less pain with menstruation, reduce ovulation pain and or ovulation cysts. And so there is not a link between low dose birth control pills and any sort of risk of cancer in the future. In fact, there's data that if women have been on a birth control pill, an oral contraceptive pill in their lifetime for continuous time of at least, I think it's 4 years, they've actually reduced their risk of having ovarian cancer in their lifetime in the future. The peak of ovarian cancer is in the late 60s, 70s. So there is benefit to suppressing ovulation early in life.
And I think
which
that's
then
such an
reduces your
important
risk of
message. Have you seen this a lot in your practice, or
I think that I tend to take care of women who don't use oral birth control pills very often, but my associate does that all day, every day. And the other benefits for young women, controlling their skin, allowing them to have little to no periods so they can be athletic and compete on teams and go to the swim club and do all the things.
Talk about sex. You often say that women can and should have an amazing sex life at any age. So what's the secret?
Again, the secret is always education, knowing our bodies first and foremost. And most of us are not taught about our bodies, and we're not really out there investigating. I would say the younger generations now probably have more access to things because of the internet and the acceptability of porn and all the different things that are out there. Depending on the generation, our background, our exposure, who we take our cues from is very different. So for me, first of all, know your body, what makes you feel good, knowing that orgasm is an amazing thing to experience. And if it's something that you haven't experienced, that we need to get some education to learn how to have not only an orgasm for ourselves, but then if we're comfortable sharing that with a partner, you can really increase the intimacy and the connection with the partner when you let down your guard and figure out what makes you feel good. I do tell my patients every day that women can have sex for the rest of their lives, and not all men are going to be able to have intercourse, not just sex, for the rest of their lives. So sex is kissing and texting and touching and masturbation and intercourse and everything in between. And so you can still have an awesome sexual relationship with yourself or with your partner, and it doesn't have to include intercourse. And I think that's the thing that I experience the most in my practice, because I have such a wide range of women, and I have patients in their 70s and 80s who are having the best sex of their life with their partner because their kids are grown, they're retired, they're on their vacations, they have hormone balance, and they're like, oh my God, we don't care. And I have to talk to them very frankly about, okay, you've got a bad knee, you've got a bad back, let's figure out the right position so nobody's hurting themselves in this endeavor. And it's the best conversations ever.
That is so.
My 70s and 80-year-olds are having good sex. And it's because they can talk to me. Even culturally, I have a woman who's in her 80s who's Japanese, and believe me, they are not talking about anything. She has a new partner. Her husband unfortunately passed away, and they want to be intimate. And she's, I don't know what to do. We just had sex to have babies, and that was it. And so really trying to understand that cultural background, but more than that, giving someone a safe space to feel comfortable. So I ask the questions. I asked, what's your drive like? And I will tell you, the worst thing is that women on my little checkbox, severe drop in sex drive is what I see every day. That's the biggest one. That's the most common, up to 45%.
So what do you, when someone checks that box, what are the questions you're asking? And I love that you're even asking that first question, because that so rarely happens in medicine. And having a good sex life is just so critical to our longevity and so many things about our life. When they check that box, what do you do next?
The first thing I say is, would you like to have a better sex drive? Because not everybody wants a better sex drive, and I don't need to really push that issue. If someone is in a loving relationship where their partner they're not going to be able to have intercourse. And I have a lot of patients who have older partners who have Parkinson's or have dementia and things like that. So for me to really push that person's sex drive for that specific reason doesn't make sense. So my first question is, do you want a better sex drive? Do you want to have more desire? My second question is, if they say, I don't have any sex drive, if I could never have sex again, I wouldn't care. I said, okay, do you have any desire to pleasure yourself? And most women will say, if they're in that category, say, not really. So that's a true drive issue. If they're like, I have great orgasms by myself, but I'm not connecting with my partner, then I have to ask the question, what's your relationship like? Do you want your sexual wellness to be better with your partner? Is there a mismatch there? Is there a relationship issue? So I do get into that a little bit. And then my last question is, besides, are you dry? Do you have pain? What sort of, are you using lube? Can you have an orgasm? And I say most women can only have a clitoral orgasm. I just volunteer that. So they feel like, they're like, okay, good. And they're like, yes, I can have a clitoral orgasm if I do this and this. I said, but I'd like it to be stronger, is what I hear sometimes as we get a little bit older. And then I always ask the question, have you ever had a vaginal orgasm? Because I admit I didn't have one till I was 52 because I didn't really know what that was. When I figured that out after I sat on that darn chair in the other room, and I realized that that's a different situation, and it's so nice, and I describe what it's like, and I can help you figure that one out too. Believe me, we're all sitting in our clothes. There's no sex therapy going on.
That is so
but
awesome.
Women are just oh my God, I get to talk to somebody.
You're
about
having
this.
those conversations. I'm also having those conversations, and it's just the best. I think giving women that, like you said, that space and time to really be heard in something that is just never talked about, maybe outside of like their girlfriend circle, and even that is rarely happens. So thank you for doing that. So let's talk about hormone therapy to support that. Like when that is the issue, when it's about sexual health and restoring sexual balance, how does that play in specific to that issue?
It's always the multi-factorial approach. I'm sure you do the same thing. You need to be properly hydrated, sleep. You need to have some movement and mindfulness in your life. You need to have a good diet, proper nutrition, sometimes supplements, and then hormone balance is the bottom of that list. So I actually go through the whole pyramid with patients. Not every woman, and I don't know what the percentage is, responds to testosterone therapy as a driver. I have a small subset of women, and it's probably less than 10%. I don't know if you can think about your own practice, where I will get them optimized with their hormones, estrogen, a little bit of testosterone, progesterone, and they're like, I still have zero sex drive. And so I go back to then those questions of, do you have a drive to masturbate or pleasure yourself, if they were someone who would already have been doing that? And they're like, yeah, okay, that's coming up a little bit. I do get a little bit of that interest. Are you spontaneously thinking about sex? But there is a small subset who I really push their testosterone, which is one of the drivers for sexual wellness for women. It does usually give a spontaneous drive. Some of my patients are like, oh my gosh, I feel like a teenage boy. And other women are like, I want what my friend has, and they won't ever get there, even if I give them the same recipe. So it's so varied, right? So hormone optimization is the first layer, and some women just get that even with their just a little bit of estrogen, and they may not choose to go on testosterone. But I do talk about the other benefits about preserving muscle mass and bone health, because I take testosterone. My levels are not super high. I do not look like I have testosterone overload. I'm leaner than I've ever been, and I'm working out about the same as I've worked out most of my life on and off. So I will say that it does help body composition, and that takes a while. Usually my observation is 6 to 9 months of being on some nice level of that, and you'll see a drop in the body fat and the muscle. Going back to things that I also do besides hormone optimization, there are some supplements out there that work. Ashwagandha, maca combinations tend to be in all the libido supplements. I think those do help. They just lower the pleasure, I would say the threshold for pleasure and well-being in the brain. And then recently I've added back to my practice and observing the variable increase with oxytocin. And I don't know if you've ever used oxytocin. It can be used daily for anxiety. It can be used for drive. It can be used for ADHD and autism, for connectiveness. And so I'm adding that back into the practice just to see. I hadn't used it enough to see if I like the benefits after someone is hormonal. You can have it compounded nasal spray, which is the quickest absorption. And the other form that I like is actually a gel that you rub on, which I don't have a ton of experience with yet, but I have a compounding pharmacy that has some published data on it, actually using it in ADHD and autism and also anxiety. And I think you get a little bit more sustained level with the transdermal versus a nasal spray, which has a short half-life of what's up in the blood within 20 minutes. You maybe get 2 hours of elevated oxytocin, and then it comes back down. So typically oxytocin nasally should be used twice a day. If you're going to do it right before, to boost that intimate connection. You want to do it about 30 minutes before you know you're going to be intimate with a partner. And then you have nitric oxide boosters out there that help with arousal. So mostly citrulline and arginine are in every supplement that supports that. And you can actually take that orally daily, which does give you a little bit more blood flow, or you can apply it directly to the clitoral area to increase sensitivity and blood flow to the area. And I do think
That's
that works
fascinating. I
nice
had
well
not
when we're
heard about
talking
the oxytocin
specifically for
component, so I'll
arousal.
have to look into that. That's very cool. Let's talk. Yeah, yes,
Yes,
yeah.
I just put my youngest, pardon me, because I have a child who's on the spectrum, and we just went on oxytocin. We had done it one time before. He's now taking Accutane, which makes his mood a little flat, and that's the only medicine he's on. And I was like, you know what, I want something, because he's on all the good supplements, the L-theanine and this and that, and the ashwagandha, and he takes the most amazing array of supplements and has a great diet. But we just went on oxytocin.
Oh, that's
That gave us
great.
a
That's
little
so
bit more
exciting for
connection
him
as a
and for
junior in
you.
high school.
Awesome. Let's talk a little bit about the actual vaginal tissue changes that are happening during perimenopause, postmenopause as well, because that vaginal dryness, that atrophy is a really big deal that a lot of women maybe don't necessarily understand. And that is one of the many factors that comes into play with sexual health and libido and drive and all of that that is often ignored. So can you break that down for us and talk about maybe some of the topical estrogens and how they work, and tell us what's happening.
Sure. So the lower genital tract is very sensitive to both estrogens and actually testosterone as well. We have changes in the vaginal tissue as early as 5 years, sometimes before we actually go through menopause. But most women will describe it within 2 years of menopause, having some sort of change. That is called genitourinary syndrome of menopause. So what does that look like? That's a thinning of the tissue in the vulva outside, vagina inside, right? So a lot of people refer to their outside as their vagina and they just lump it all together. But bottom line is the outside is the vulva, the inside is the vagina. And those tissues thin out pretty readily as we enter perimenopause, which starts in our 40s. So if we think about midlife, if the average woman lives till 80s, our midlife starts in our 40s. And a lot of women don't think about that. We think 50s, we're in midlife, but technically you're in midlife sometimes even in your early 40s, late 30s. And what we start to see in the menstrual cycle is the estrogen goes really high and really low. So we get really big fluctuations of estrogen. And then progesterone ping pongs around as well, but starts to drop. And then testosterone has a steady decline over time. So you have this sort of erratic up and down of your hormones. And that's why women have a lot of different changes that are also related to mood, irritability, motivation. And because we have so many estrogen receptors in our brain, so we see a lot of changes. And that's why women have so many different hormonal moments in their life, right? True. Yeah, you're truly hormonal. That is a true checkbox. But the feminine tissues thin out. Once they start to thin out, it's a downslope. And this really needs to be like one of the big like national campaigns of get to your skin before it's too late. Because as women have changes down there, of course, you see them on your face and you get wrinkles. All that tissue down there is having the same changes, but not just from an aesthetic standpoint. When we have lower estrogen in our vagina, we have risk of pain, tearing. The bacterial shift in our vaginal microbiome is profound. And then we actually have less glycogen. So we have these bacteria growing that are more likely to be pathogenic to our vagina, and then they crawl up into our urethra. It's not that E. coli didn't live there our whole life, or in that area, if you will, in the perianal area in the vagina, but that our ability to balance that changes as we age. And all of a sudden, those kinds of things can get into our bladder, and then we can have a bladder infection, or we get a shift in pH and we have a vaginitis of various different degrees of bacteria. The pH shifts, we get bacterial vaginosis, we get yeast, right? Because we're not as acidic in the vagina. We need to have an acid environment in the vagina to keep the bacteria and the good bacteria, the lactobacillus and those other bacteria in a good range. And so all of that shift puts us at increased risk of infection, dryness, pain, And then we have thinning of the collagen layers that are underneath the skin in the vagina, specifically under the neck of the bladder, urinary
How do
incontinence, the whole
topical
issue.
hormones help that specific case? Because a lot of women feel they may be taking just oral estrogen or doing some compounded estrogen systemically, but then they're still having these vaginal issues. How can we address?
I would, again, skin is skin. You've heard me say that every time. And if we're going to put 4 creams on our face every night, you better take care of the skin down there. So what's your nighttime regimen for your vulvar skin and your vagina skin? And so using a topical estradiol, which is the most specific thing that you could do to restore that tissue health. And some women are still uneasy because unfortunately the estradiol box still has a black box warning on it. It says if you use estrogen, you're going to get a stroke. And so just recently, about 3-4 weeks ago, there were many menopausal physicians.
May have also been
Doctors who
menopausal
take
and
care of women
really
in
pissed
menopause
off.
at the FDA.
Yes.
They were probably in menopause. They were all at the FDA trying to get the black box warning removed from vaginal estrogen. So that might be the first step so that women feel comfortable about using estradiol in their vagina. But it's the first layer of restoration. And you typically
Right.
don't need a ton. And I actually don't even have my women insert it unless they're having a lot of thinning in the upper vagina, because there are some women that get super thin in the upper vagina, but that happens much later in life. It seems to be the lower third. So typically we're just applying it with our finger multiple times a week. And that's a game changer. I do have women who don't respond to that, which is really interesting. They definitely need systemic support as well if they're not responding topically. Of course, radio frequency is an option. And then I'll compound DHEA, which is one of the mother hormones coming straight down from pregnenolone. We have DHEA, and it really can translate into a lot of other hormones in our body. But DHEA, the receptors down there really recognize it as a sex hormone.
That's so helpful.
So the tissue down.
So I know you're working on a new book
well.
and a concept related to the big O. Can you give us a sneak peek as to what that's about?
And what's great is I have mentors like you and our other colleagues, Dr. Holden, who have done the work. And I'm so looking forward to sharing this project with you eventually on the down low until we get some intellectual property protection, right? Because I need to know all about that. But for me, it really stemmed from the big O. And what does O mean? And so I will tell you that it branches out from all the O's that are in our life. It's really a way of life. It's a movement. It's going to be a podcast. It's going to be a workshop. It's going to be a workbook. It's just going to be a way for women to journal about it's how we should really approach our lives. And that's all I can tell you right now. But I'm looking forward to trying to get that thing
love
finished
it.
so that
I
I
am
can
so
start
excited.
rolling it out
wait
in
to
all
hear
those
more
aspects.
about it. On that note, what message do you most want women to hear right now about their health? What does Dr. Trish want to tell the world?
So let me tell you 3 take-home points. 1, you have to be your own advocate. And if you are not feeling well and your doctor says your labs look fine, you're good to go, then you need to find another provider and keep searching because you know your body. So you want to make sure that you are getting the answers that you seek and also educating yourself so that you can have a meaningful conversation with anybody who's talking to you about health, whether it's your girlfriend, your doctor, your primary care doctor. That's important. Let's see, take home point number 2, muscle matters. I want you to go out and lift weights carefully and gently, but I want you to invest in your body because we have the potential to live to 120. And the only way we're going to do that is if we do all the things. There is not one magic bullet that's going to take care of it. You've got to do it all. I am sorry, but you've got to do it all. And you know what? You will be happy once you do it because you're going to feel awesome, right? And then number 3, remember that being sexual and having proper sexual health is an amazing part of life. And there are those of us out there that want to help you achieve your best sexual health and live your best life in your best body. And I'm here to help you, as is Dr. Nanos. Reach out to me on Instagram at Dr. Trish MD.
I didn't know that. We're going to put all that in our show notes,
knows?
and it's going to be at the bottom of the thing. So we'll make sure that everyone does that. I like to close with a few rapid fire fun questions. These are just super quick, just whatever comes to top of mind. Okay, ready? What's your fuel of choice? Espresso shot, spicy margarita, or green juice? Or you can choose all of them.
Oh my.
Okay, great. What
No.
is your
So I
fuel
don't
of
drink
choice?
any of those, but my fuel of choice.
Perfect.
I drink
That's
three things:
even
water
better.
and rosé.
Okay, so I know you love to roller skate and dance. So what's the one song that always gets you on the dance floor, no matter how bad the DJ is?
Oh my goodness.
That's such a good one.
Probably
Love
It's Getting
it.
Hot in Here by Nelly.
I know you're a master yoga instructor. I've seen you do some incredible yoga moves that I would never try at home. When you need to shake off stress, what's your go-to? Are you more of get deep into the yoga poses or turn up the volume, dance it out?
Of course, exercise has always been my go-to, whatever form of exercise it is. But when my child was diagnosed with autism when he was about 2.5, 3 years old, I found hot yoga. So regular yoga doesn't do it for me. I actually have to go in and basically sweat out buckets of tears. And so we talk about when we do hot yoga, we're letting go of our tears and their prayers, and we let go of it all. And I've never had such a cathartic experience when I had done my first hot yoga class. And so I knew it was my jam. And a lot of women are afraid to get into the heat, but heat is so important, which we didn't even talk about. The 3 things to increase your metabolism: muscle, heat, and thyroid health. And I tell women to go sit in a sauna. I don't care, just 3 days a week. Heat up your body from the inside out. It is so therapeutic. And so for me, if I go in the hot room, I can shut my brain off for an hour.
I love
And
that. Yeah, that is
it's my
great.
go-to
I
for the
love
last
hot
10 years.
yoga. If it's not hot, I'm not interested. I'm the same way. Do you teach at all? Are you still teaching anywhere?
Same here. So I taught this morning hot sculpts.
Yes,
Two,
that's my
metabolism, lift
aggressive
weights
sculpt
in the
class
heat.
is like my favorite thing. Where are you teaching?
Yeah, I teach up in Rancho Santa Margarita at Sweat Star Yoga, which is the studio I've always worked out at. And I have relationships with lots of different hot
That's so fun.
studios around here. And so it's
Yeah.
just, it's my space. I could be anywhere. COVID practically killed us because all of us were in our
Oh my
bathrooms
God.
with heaters on, trying to do Zooms of yoga. It
Oh
was
my God.
terrible. It was hard
And
for
then
all of
any
us.
final
It was
thoughts?
really
Anything else
crazy.
that we haven't covered that you want to share that you think it's important for the world to know? You've already dropped so much amazing knowledge on us today.
I would just say that we're always trying as women to be perfect and do it all. And when I said earlier, you got to do it all, I meant you really got to approach your health from multiple areas. But we can't always be 100% in every aspect. So give yourself grace and know that tomorrow's another day. And all you need to do is start with one baby step towards one of these areas of your life. And once you've mastered it, you add the next one. And I'm the same way. I feel behind sometimes in my life. I'm like, God, I want to get this concept running. And how can I do it? And I don't have the time. And I just give myself a little grace, and I'm exactly where I'm supposed to be at this time in my
You're
life.
exactly
Comes when you're
so
supposed to
incredible.
have it.
Thank you so much, Dr. Tricia Wallace. And I am so grateful for this time. Thank you, everyone, for listening. We're going to share all of Dr. Wallace's info. Please connect with her. If you have questions, send us a DM, send us a question. We're all here for you, wanting to support women as much as we can in this journey of life. And thank you again. You're the best. If this gave you something real, hope, perspective, or a fresh way to think about health, please share it, subscribe, and pass it on. Medicine won't change on its own, but together we can reimagine it and build something smarter, kinder, and create a system that truly heals. This is The Kind Revolution with Dr. Nanos, where science meets compassion and the future of medicine gets brighter one conversation at a time. Thanks for joining the revolution.